The second wave of the H1N1 influenza has hit communities across Canada as the medical community awaits shipments of the vaccine to health regions across the country. The initial vaccination campaign launched on October 26 for healthcare workers, and according to local health officials, this will also include EMS and fire department employees. Now this week, pregnant women and children 6 months of age to less than 5 years old will have the opportunity to receive the H1N1 vaccine in their respective health regions. Here in the Southwest, vaccinations will take place November 2nd, 3rd, 5th, and 6th from 9 a.m. to 4 p.m. at the Wheatland Mall. This series of clinics will be open to Swift Current and area residents in this category alone, with out-of-town residents asked to drive in for these specific clinics until additional vaccine arrives and a staged rollout of the campaign begins across the region.
We are going to try meet the needs of everybody within the high-risk group that we've identified for next week in an effective and efficient way as we can. So we will use a numbering system so that we know how many people right away we'll be able to get through in that day, and then we can let people know right away that they're not going to be able to get vaccinated and they'll have to come back the next day. That way they're not standing in line for potentially an hour extra when we could have told them and had them on their way.
And as the general population awaits their turn for the H1N1 vaccination, and many in the province are already ill with the virus, those in the health community note there is no cause for alarm.
We don't have a prediction of how long the wave will be, so you wouldn't really say it's too late, because there usually is a third wave as well, and if we can avoid a third wave, that is still more people being protected against illness. If we can get at whatever stage of the second wave we can, we're still protecting a number of individuals. Of course, until that stage, we still advise the precautions. Just like we went through the summer, we did not have vaccine in the summer, and we went through the first wave, and it was again a lot of the precautions, a lot of what we're advising people to do.
Those standard precautions include washing your hands thoroughly several times a day, washing down hard surfaces at the home or office with a bleach-water combination, and staying home if you are feeling ill.
But especially in this, we know how fast that this can spread and how quickly. So, avoid those social gatherings. Unfortunately, we use the Broncos as an example. I mean, we put 27 to 3,000 people into a building. If people are ill, we need them to stay home. It doesn't help our economy, we know that. But if people stay home for a couple days, they'll get better and they can resume their normal core of activities. However, if we lose a whole community, then we have that domino effect that we'd like to stay away from. You are most infectious 24 hours prior to showing signs and symptoms, and upwards of 3 to 5 days afterwards. So that's the message that we're giving to people: is stay home until you feel better, or 7 days, whichever is shorter. Some people will feel better after 3 days, some people will feel better after 5 days. But if you're at day 7 and you're still just not 100%, you're probably not shedding the virus anymore and won't infect anybody. You can resume your normal course of activities.
Health officials further state that everyone, including seniors, other than those with allergies to eggs, should line up for the H1N1 vaccine when it becomes available in their community.
The vaccine goes through very strict checks for the quality, for the safety, and as you know, there have been trials ongoing, and also a number of the components of the vaccine are components we've already had and we use in our regular seasonal influenzas, so it is a safe vaccine. It has been deemed safe.
Symptoms of the H1N1 influenza include cough and fever, fatigue, muscle aches, sore throat, headache, decreased appetite, runny nose, and sometimes nausea, vomiting, and diarrhea. If symptoms do persist or worsen, you're advised to contact your local physician immediately. According to numbers released by the Cypress Health Region, they've allotted $8.5 million for the H1N1 vaccination campaign, covering supplies, staffing, and other additional costs.